At the height of the recession, Congress threw millions of Americans a lifeline. It boosted federal funding for Medicaid by $100 billion to pay for medical care for the down and out. But no one expected unemployment to be this high this long, and now the extra Medicaid money runs out tonight. We asked Bill Whitaker to show us who depends on the emergency funds.
Come in.
Hi.
Hi.
We met Sharon Brown and her 10-year-old daughter Rosa at the Arroyo Vista Family Health Center, a nonprofit community clinic in Los Angeles, where Rosa came for strep throat. With a family income below the federal poverty line of $18,310 a year, Rosa's treatment and Sharon's checkup cost just $1 each.
Are you still taking the antibiotic?
Yeah.
The rest paid by the joint state-federal low-income medical program, Medicaid.
I depend on it a lot because I have 3 children. I use it for their yearly physical, for their eyes checked, for the dentist, for their shots, to make sure they're all caught up for school.
But with the temporary infusion of federal funds to Medicaid running out, California is taking a $4.8 billion hit. So like most states, California is scrambling to reduce costs, cutting services, cutting doctors' payments, raising patients' co-payments. $5 for office visits, $50 for emergency rooms, $100 to $200 a day for hospital stays. You might think that's not much.
But you know what? You're wrong. You're so wrong. Because people do need it. People count on it.
Sharon lost her job as a cafeteria worker when LA schools made drastic staff cuts a year ago. She's had no luck finding work since. Her extended family lives on the edge of downtown and on the edge financially. Renting out the front of their modest house to pay the mortgage, they all live crammed here in the back.
I mean, we have bills to pay, we have food for children, their clothing.
Gasoline.
The gasoline, the light bill, the water bill, the gas bill.
Everything's going up.
Going up.
Sharon is one of 7,650,000 Californians on Medicaid. 42% of the patients here at the Arroyo Vista Clinic rely on Medicaid. CEO Lorraine Estrada says with the cuts,
our revenue will go down, which means potentially cutting on services and layoffs, which is unfortunate.
Pediatrician Anal Desai worries about her patients.
Will they end up in an emergency room? I don't know. We're talking about cutting cost here. ER visit, hospitalizations are going to increase the cost.
California already is struggling with a budget crisis of its own and doesn't have the funds to make up for the federal cuts to Medicaid. With unemployment here near 12%, among the highest in the country, the Arroyo Vista Clinic and others like it don't expect to see any reduction in need. Bill Whitaker, CBS News, Los Angeles.